Thank you so much, Olga. That was a great launch of not only the imperative, but what is possible. So thank you so much. Tom Stinson, I'm going to go to you next, and if you would introduce yourself as well before you begin speaking, so folks know who they get to hear from. Thanks.
Thanks, Mayor Catherine. My name is Tom Stinson. I'm a registered nurse for the St. Paul Public Schools. This is my 19th year, coming up on my 20th year, so I'm finally starting to figure things out. I'm also a member of the St. Paul Federation of Teachers Union, along with the AFT Healthcare Professionals PPC. Just like many of you, we have multiple hats. So today I'll be speaking from my lens of a nurse in a school, more specifically in a public school, where I have 2,000 kids. I like PowerPoints to keep me on track. It's not for you. Here's the agenda. We're just going to launch right into this. This first bullet is courageous conversations. I teach also in a nursing program for the last 5 years. And the fourth week of my class is on courageous conversations. And I think that's important for healthcare because as nurses, we have to have difficult conversations all the time. It's never fun to sit down with a patient and tell them they're not managing their disease well. They're maybe possibly causing some of these problems themselves by not being in compliance with medication. Or an example like their wounds are not healing because they're not taking care of themselves. But we need to have a courageous conversation together today about, is healthcare right for people living in the U.S.? That's my question. We have to be honest. My belief, and if I keep it personal, local, and immediate, is we have to have healthcare for everybody. The last bullet, is healthcare affordable to all? Even my employer at the St. Paul Public Schools, it costs me $5,000 a year. For me, I can afford that. I don't like to have to pay that out of pocket, but I can afford that. The families and the kids in my district cannot afford pay at all. They can't go to the doctor because they can't afford the initial costs. If they have insurance, they can't afford co-payments. I have this little graph down here, and it kind of segues real good with Olga's topic around mental health. So if you just look at a few of those statistics, 1 in 5 children ages 0 to 11 experience a mental disorder in a given year. We heard that with Rasul's story. 50% of all mental health illnesses begin by age 14. These children become adults, like Olga mentioned. Early intervention is important. To discuss these and have this courageous conversation now about why it's important for kids to have access to health care is vital. If you look down at 10%, of all children experience some impairment in daily functional at home and school. You cannot learn if you have a lot of issues going on. We can't get to critical thinking, right? Maslow's hierarchy of learning until our basic needs are met. How do we synthesize? How do we analyze it if we can't even get through the day because of our chronic disease, for an example, asthma? Access to health care. No matter who I've ever talked to in my life over the last 20 years, access is the #1 barrier. Whether it's a cost issue, transportation issue, language issue, or accessibility. If you live 2 blocks from the clinic but can't get to the clinic, what's the use? If you live in greater Minnesota and it's an hour and a half to the clinic, there's no accessibility for you. What are we going to do? We see our public health dollars diminishing every year since Reagan. There's no money for public health. But there's still services that need to be provided. The loss of the Affordable Care Act is going to be a problem if it goes through. You guys have been paying attention. If you skimmed over the new language now from our president, about 30 million people could possibly lose insurance. Of that 30 million, about 4 to 5 million are children. That's a huge number. The last bullet there just talks about my profession specifically, and that the American Academy of Pediatrics clearly stated back in 2016 that it is essential that all students have access to a full-time school nurse every day, everywhere. Not a health aide, not a wonderful parent like my mom was who volunteered at the school to give out Band-Aids or clean wounds. A registered nurse who's a professional for that. And in this case, other providers such as social workers, counselors, speech clinicians, OT, and PT. Remember, I'm speaking from my lens of a nurse, but we have to remember there's multiple healthcare providers that are available for our kids that have to be accessible in schools. Olga brought this up about the impact health has on learning. It's extremely clear that students' health is directly related to their ability to learn. My first couple years I worked at elementary school. There was 800 K through 6th graders and 400 K through 6th graders in 2 schools that were together, so 1,200 kids. There was 9 all-day kindergartens. At average about 30, there was over 200 5-year-olds. About 50 kids came to my office with asthma issues. How well do you think a 5-year-old performs in school when they don't manage their asthma? When they wake up 6 to 15 times a day? I'm whispering now, but I get crabby if I wake up once during the night. Kids are not managing their diseases properly, and schools can be vital to help that process for chronic disease management. And we see the second bullet, children with unmet health needs have a difficult time engaging in the educational process. We discussed that just earlier, a few minutes ago. And it's important to address the physical and the mental, the emotional and the social health needs of our students. And once again, the school nurse plays an essential role in keeping kids healthy and safe and ready to learn. My little picture down at the bottom there, if we don't speak for kids, and when I say we, I say me. This is about me right now. It's about what I can do. I never ask anybody to do anything that I'm not willing to do myself. But if we can't speak for kids, or I can't, how can we expect kids to speak for themselves if we don't give them the tools early on and the support? But I think we're lucky as well, right? We have this opportunity to access funding. We see that in 2014, towards the end of the year, we had the change in the free care rule. And I know there's people here that are more of expertise, and they can touch base on that later on today. But these services are already being provided right now in our schools. We do have a potential for reimbursement, but we need to educate others about this opportunity. And we have to involve stakeholders, whoever they may be. I'll touch base on the next slide. And this is my favorite bullet, the last one here. We have to be part of the solution. When I say be part of it, that's me. That's what can I do to be part of the solution? Whether it's St. Paul Federation of Teachers or AFT, we are solution-driven on everything we do. If we come to organizations without a solution, then someone else will give us a solution. So it's better to be prepared and have an example ready. And that's what I'll walk through on this next one. If you see this little picture here at the bottom, only about 50% of our public schools have a full-time nurse, if you're lucky. We have schools that have no nurse. We have schools that have a nurse maybe go half a day a week, 2 days a week, 3 days a week, you know. Information to support health care in schools. This is just a little bit of data here. We have over 40 million children that are on Medicaid in our schools, public schools primarily. And the school nurse provides health care around these services. We keep students ready to learn. Most of the time, we're the only health care provider in this academic setting. I remind myself sometimes that a nurse in a school is no different than a nurse in a hospital. We provide the exact same service. We just happen to be in a school. Our social workers, they're wonderful. They perform the same service in the school as you would at a facility outside of the school setting. Same thing with OT and PT. Every one of these services are provided the same, but in a different environment. That last bullet, 11.2 million children have some kind of health need. If we reflect back, 4 million people, 4 million students maybe are going to lose insurance through their ACA if it gets repealed. This is almost 3 times as many. Has nothing to do with the ACA. 3 times as many as earlier on. Here's just an example. I like examples to kind of walk through something. So we just want to look at a licensed school nurse, but remember, you could put in here another healthcare provider in the public school setting. So how I envision we'd have this reimbursement program. And the vision for me, or for us, if you want to go along on this ride with me, would be keep children healthy and ready to learn, a very broad vision. With the goal, potential funding to be delivered in the school setting. Stakeholders, like we mentioned earlier, a slide or two before, the federal government, the state government, school board support. You have to get buy-in from people. And we have to reflect back to the idea of, if people don't know, that's our fault for not educating them. They need to understand that we have an opportunity to possibly get reimbursements for services that we provide in schools. And once again, a qualified provider, and in this case, the school nurse is considered a qualified provider. Just a couple examples of a reimbursement. Chronic disease such as asthma. Do you know in 2015, we spent $100 billion on asthma? That's about $1,500 a year on kids who have asthma. About 11 million days of school were missed because you had asthma if you were a student. But you know what Olga brought up earlier about the effect that it has as you go into adulthood? 15 million adults missed work because of asthma. I just read another article. We are approaching over $825 billion on a chronic disease for diabetes globally. Here we're at like 300 plus billion in America. Diabetes, I have a slide coming up that we can touch base on a little bit of data, because I know you guys are data driven. Mental health, like Olga mentioned. And just glance at this graph, just two things I want to point out. Chronic disease accounts for 3 of every $4 spent on healthcare. And if you look in the bottom left, where the big number 1 is, medical expenses are the number 1 causes of bankruptcy in America. That blew me away. I didn't even think of that. Didn't even register with me, because I'm not processing that all the time, because I'm in my world of education and kids and healthcare and ACA and repeal and what it's going to look like. I thought that was amazing. The key for all this is the documentation that needs to be provided so we can possibly resubmit our services. So let's kind of walk through what that would look like in my office. So we have a student who has a diagnosis of diabetes from a physician. So now we have this chronic disease diagnosis. The physician says what do they say to us? Hey, Tom, please provide this services, and here's the order. The order, which would be the sliding scale for their blood sugars, their carbohydrate conversion. The student then comes into my office. I see 5 students a day with diabetes. They come in, they're wonderful. They have bad days too, just like we do. They have really bad days when their blood sugar is 550, if we know what that means, right? Our normal blood sugar is what? 80 to what? Anyone? 80 to 120 maybe? They're having a rough day. So what we do is we manage that disease in our office. We check the blood sugars. We look at that number to determine what it is, provide medication. Have a courageous conversation again. Just like on Monday. The 9th grader came in and she was 550, and I'm thinking, what's wrong with you? What is wrong? Why is that number 550? Too much carbs? Not enough insulin? Did she wake up in the middle of the night low and just ate a whole bunch because she was nervous and scared and not coherent? We walked through the scenario. She doesn't want to tell me. I see her every day, twice a day. So just figure it out. I've seen her 200 times already this year. Kids don't want to disappoint you. 2 years ago, a student told me one time she lied to me and she would add 100 units, subtract 100 units on her blood sugars. So if she was 200, she'd say she was 100. If she was 400, 300. And one day I looked down there and I said, oh my God, she's been lying to me every day. So I asked her. It wasn't fun. She said, I didn't want to let you down. She didn't want to let me down. I'm a parent as well. I forgot to mention that in my bio. My most proudest thing I ever did was being a parent. That was difficult. Because my goal would be, we don't care what the number is, we want to know why the number is the number, right? Why is it high, why is it low? And also, when things are going well, nice job. Advocate with them, support them, let them know they're doing things right now. So at the end of this year, what I'm saying is, we provide this service in the school setting, and then what we do is we're going to ask for reimbursement. It's like bringing your car in. You drop your car off, they fix it, and you got to pay the guy. You don't pay him up front. You provide the service, and then you say, by the way, I'm a registered nurse in the St. Paul Public Schools. I would like to get reimbursed for the services that we provided to this student so they can return to the classroom and be ready to learn. Our lives begin to end the day we become silent about things that matter. For me, kids matter. My whole master's degree, my whole doctorate degree, all looked at how can I be a better nurse? How can I be a better provider? How can I make a difference every day with the kids I work with?